at all when you urinate, when you pee at all?
Mm-mm.
Any pressure sensation and at all that you have? Any type of discharge or color change, dark colored urine at all, or concentrated urine at all? No. Okay. Are you able to hold your urine okay? No problem with inconsistencies with incontinence? Unable to hold your urine? Let's see. You live in what city or state do you live in?
Saginaw.
And you're in Michigan. And let's see. Are you in a rural area or city or subdivision?
City.
City here.
Subdivision.
Subdivision. City and subdivision here. And you live in a home. You live in an apartment.
Home.
Okay. Do you know of any exposures to any type of ozone layer problems, any combustion or factory at all, combustion or pollutants at all? No? Okay.
Mm-hmm.
Occupational health, known exposures that you know about to environment or toxins at your workplace at all? Okay. No. Functional assessment, activities of daily living, you're okay with abilities to wash up, brush your teeth, put your clothes on. Interpersonal relationship with a significant other, with your husband, how is that relationship? Good. Okay. Your resources, your funding sources, would you say that your resources, you have a little bit, enough, or more than enough to cover your needs for resources? A little bit? Enough? Okay, gotcha. Okay. Let's see here. Your role in the family. You're considered, your role is the
Mother.
You're the mother then, and then also you are relationship wise. You're the wife. Okay, thank you kindly. In the immediate family right now where you're living, what consists of the family in the home right now where you're living right now? It's
What?
you, and then you. You're the wife. You have a husband. Who else is in the family? Son
And mother.
and mother. Okay. And who in the family, you make the decisions in the family? Do you make them with your husband, decisions?
Together, yeah.
Together. Okay, thank you. Your impact of the family members, health on the family. Are you a caregiver in the family also too?
Mm-hmm.
Okay. Cognitive function, how is your memory?
Good.
Good. And your speech?
Good.
Your judgment to make decisions?
Good.
Okay. Your senses, taste, smell, hearing, all that's good? Okay. How is your rest and sleep patterns? Any problem with sleeping at all? Going to sleep problems, staying to sleep problems?
Once I get to sleep, if I have to go to the bathroom, it's hard to get back to sleep.
Okay, so once you go to sleep, when you go to the bathroom, when going to the bathroom, when going to the bathroom, you hard to return to sleep.
Mm-hmm.
Thank you. Are you taking any type of supplements, melatonin, or something for sleep at all?
Mm-mm.
Let's take a look here. Would they say in your family, would they say that you snore during your sleep?
Only if I'm real tired.
With snoring when tired only. Does anybody say that you stop breathing during your sleep apnea at all?
Mm.
Does anyone say that you have restless leg syndrome? You move around a whole lot in the bed during the sleep? Okay. Let's take a look here. How many hours of sleep you say you get a night?
Let's see, 5.
5 hours of sleep on a nightly basis? 5 hours nightly. That's not so good. Let's see what's going on with, but you're not drinking any caffeinated beverages. You gotta find out why you're not sleeping enough.
I drink a lot of water, so I'm up a lot. Use
So
the bathroom
maybe
during the night.
going to the bathroom a lot. So then maybe you need to cut your water off at a certain time, so that in the daytime, so you won't be up all at night urinating. So that may be something you may want to consider. Okay. Let's take a look here. You take any naps at all?
Only if I'm really tired.
As needed. Normal Number of pillows you sleep on at night.
Got about 4 pillows.
Sleep on 4 pillows a night? 4 pillows, okay. 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 Exercise pattern. Do you exercise?
Start Monday.
Are you starting on Monday? I'll put starting. Will start. And then I'll put plan. Your plan to start is twice a week exercising, or 30 minutes a day, or 5 days a week, or
I'll probably start out doing maybe an hour of walking every other day.
So plan is an hour of walking every other day. Okay. And you're starting you're going to do this because it's cold outside now.
Mm-hmm.
So you're going to do this at the gym.
Center.
Okay.
Center.
Fitness center. Thank you. Okay. Let's take a look. Any hobbies you have right now, or things you do for recreational at all? Do you knit? Do you sew? Do you scrapbooking? Do you read? Do you write? Do you writing? Okay. Do you journaling too? Do you journal too? On journaling? Okay. And leisure activities. What do you do for fun?
No.
No fun. Do you go on any trips or vacations?
Yeah.
Do you? So
Travel.
trips, travel. Okay. Okay. Do you travel outside the U.S. or inside? Okay. Inside U.S. Any social habits? Any type of smoking cigarettes, chewing tobaccos? Any type of tobacco at all for you take? No? Okay. Any alcohol, beer, wine, liquor, wine coolers? Any type of marijuana at all? Street drugs at all? Okay. Any violence at all? An intimate partner violence? Okay. Questions here. Coping stress mechanisms. What do you do for that? The stress. Do you read? Do you
pray?
Right? Okay. Let's see. Any major life changes in the past 2 years?
Went from empty nest to a full house.
Empty nest to a full house. I'll put that in quotations. Let's see. Do you feel tense? Tense. Source. What helps you to decrease the tenseness?
Get along.
Get along. I'll put that in quotes. Sexual patterns. Are you sexually active right now? And you prefer sex with men, sex with women? Men, okay. Has anything changed about your sexual behavior or health function now? No changes, okay. Getting down to the general, any type of weaknesses that you have right now, or fatigue, tiredness, any new fevers at all that you have?
No.
No? Okay. We're getting there. Any skin problems, any rashes that you have?
No.
Lumps or bumps or sores, itchiness, dryness, any type of dry patches, any psoriasis, any type of eczema, dry skin, skin tags, moles, color changes, problem with your nail bed or in your fingernail bed, thickening of the nail beds, the toenails, the fingernails, any issues at all with hair thinning or hair falling out or not growing?
My hair was thinning, but it's growing back.
Growing back. Wonderful. Past thinning. Okay. Now growing back. That's good. Any type of headaches that you have currently, any migraines that you have,
I have sinus
Sinus
headaches.
headaches. How often?
Mm, once or twice a week.
1 to 2 weekly. And you said you're taking Zyrtec. You said for that now. Okay.
But I also take Excedrin.
Excedrin too. So we'll make a notation about those headaches to let the doctor know too, to see if you have any type of underlying sinus infection or anything like that. Any frontal headaches on here, any over here maxillary headaches here on your cheekbone,
Sometimes I
behind your
get
eye.
pressure behind my
Okay, pressure behind the eye. Thank you for telling me. We'll write that down so we can look into that further. Let's see, any type of dizziness at all or vertigo.
vertigo.
Vertigo. How often are you having that? Room
Uh,
is spinning, spinning, spinning. Spinning episodes.
if I get up too fast,
Okay.
it's not that often. Maybe once a month.
Okay. So normally they say pretty much when you get up, you want to get up slowly. Let your feet dangle on the side of the bed. Kind of look around and get your bearing. Once you have your equilibrium better, stand up, look around. Once you're certain of your footing, then to go proceed further like that, slowly.
Yeah.
Okay. Alrighty. So, any vision changes at all, or eye pain, redness to the eyes, or swelling? No corrective lenses. You don't have any glasses now. No. We already have your last eye exam already noted in the previous question. Excessive tearing at all. Eye keeps dripping or tearing. You have that. How often does it do that? All the
Every
time?
day. Yeah.
Daily. So we'll look at that as well daily. Excessive tearing at all. Which eye? Right eye or left eye or both?
Right.
Right eye only. We'll take a look at that further. Any double vision at all? Blurred vision at all? No. We'll check into that eye tearing. Ear problems. Any hearing problems? Any changes to your hearing? Any tinnitus, ringing of the ears? You do have that. Take a look at that. Sometimes it comes from toxicity, too much of aspirin toxicity. Look at the aspirin level and so forth with that. Ear aches at all? How often do you have ear aches?
Mm, maybe
In a
once or
week's
twice a
time?
month. In a week.
In a week's time?
Once.
Once a week? One time weekly ear aches. We'll look at that. Your nose throat works together. We'll see about that. Ear infections. How often have you had those?
Often.
Often here. And what do they normally prescribe for that? Pretty much some ear drops. Antibiotic.
Yep.
Ear drops.
Antibiotic. Ear
Antibiotic.
drops and antibiotics.
And ear antibiotics, and then some ear drops too. Optic. Ear drops here. Any type of discharge from your ear at all? Any type of, you have ear infections, you're saying? And
a lot of times it's fluid too, she said.
Fluid in your ears. And ears, we'll pick a notation of that as well. Thank you for telling me. Any type of nose or sinus problems. Any cold you have a lot. Any congestion, stuffy nose, stuffy head a lot. Any,
Sniffing a lot.
Sniffing. Okay. I'll put a notation here. Sniffing a lot, we'll put that in quotations. Nasal obstruction, any type of clogged nasal passages. Any discharge at all.
Sometimes
your
you
nose.
have a runny nose.
Runny nose, rhinitis here. As sometimes, how often would you have a runny nose? Let's say in a week's time. In a month's time.
In a month, maybe 2 to 3 times.
2 to 3 times, pretty often. Let's see, times, we have to look at that. Thank you for telling me. Type of itchy nose, any hay fever or allergies?
Hay fever. It's not that often.
Hay fever at times. Does your hay fever only affect you in the wintertime or summertime?
This year it's just been, I guess the winter.
Wintertime hay fever. Thank you for telling me. Any type of nosebleeds at all? Changes to your sense of smell at all? Sinus pain or pressure?
Pressure sometimes.
And that you said there was pretty much in behind your eyes.
Yeah.
Behind eyes. We'll look at that. Have they ever in the past did a CT scan, CAT scan, or X-ray of the sinuses in the past? On you in the past at all?
I don't think so.
Okay, it's a question mark to see what they maybe something we can do. See about that. Um, did you say that you had chronic sinusitis at all the time? Have chronic issues with your sinuses or no? That's what she said it was. So just seeing any problem with bleeding gums, mouth pain, toothache, lesions in the mouth or tongue, dentures at all that you have now. Do you have any partials right now? Dentures or all of your teeth that you had when you were born?
I have them all.
Mm-hmm.
No dentures.
Okay, no dentures. And do you have any sore throat, dry mouth, sore throat, hoarseness in your skin, in your throat, altered taste buds at all, bland taste, and unable to taste anything? No, no past tonsillectomy, move the tonsils at all. Okay, we're getting there. Neck problems, any lumps or enlarged tender nodes in your neck at all, swollen glands, lymph nodes, type of goiter swelling, dealing with thyroid problems, any pain in your neck or neck stiffness, limitation of an inability to range of motion to move your neck back and forth, up and down. No, okay. Breast problems, any lumps or bumps with your breast, any breast pain, any discomfort or soreness, any nipple discharge coming from your areola, the colored portion of the breast, any discharge, any rashes, any past surgery on your breast, any history of breast disease for you. Do you normally perform a self breast exam at least once a month, not during your menstrual cycle? 2 weeks before, 2 weeks after your menstrual cycle? Do you do that sometimes? No? Okay.
I'll
And
be forgetting.
okay, so that's something we can start introducing that to like once a month before your menstrual cycle, like 2 weeks, and after your menstrual cycle, 2 weeks, around your breast pads of your breast, and also the areola, the colored portion of the pads of the finger around there, underneath your armpit, axilla too, checking for lumps, bumps, checking for hard kernels like corn kernels too. Any areas that won't move at all, immovable, that's a note and talk with us about that. Okay? So put note right now, and you will start this self breast exam monthly. Okay. No breast tenderness, no breast swelling, and no rashes or pain underneath your armpit axilla area. Okay. Any coughing at all, dry cough, a productive cough, bringing up anything green, gray, brown, tan, or black. Any type of spitting up or coughing up any blood. Any difficulty breathing, dyspnea. Any problem with wheezing or lung problems at all. Any type of lung disease, problems like the pulmonary disease, any asthma, any type of emphysema at all, lung disease, stiff lung at all with you, any bronchitis, any type of toxins or pollutants, any asthma, and no past TB test you said you didn't have, so no. Cardiac heart issues, any chest pain or any chest pressure, any type of feeling of heaviness on your chest at all, any type of palpitations, any type of heart rate or heart feel like it's speeding up or slowing down, any type of edema swelling in your legs or feet, in your tummy, ascites, edema, swelling, any swelling or under your eyes at all, any type of blue or purple color to your arms, legs, feet. Okay, no. That's done, and this is done, and this is done. So we're narrowing down, home stretch coming down the road. Isn't that a good thing? Thank you for your patience. I want to do a very good job, do a most optimal care, give the most appropriate and best possible care. Let's see, nocturia, urinating a lot. You mentioned that you're urinating a lot, but you're drinking a lot of water. We did talk about that. Limiting your water intake in the daytime so there won't be so much urinating at night. Limit water intake, fluid intake in a day. So you have a cutoff sometime, depending what you want to cut off, 6 o'clock, 8 o'clock, whatever, to cut your water off. Drinking, 8 o'clock. What time you go to bed roughly? You think sometimes you don't go to bed till late, so like 11, you would say?
I go to bed. Sometimes I don't fall asleep till like 1 or 2 o'clock.
Wow. So you probably want to cut off your water around maybe 9 o'clock or so, 9 p.m. Cut off drinking water, and then let's see how that works. And then if you're still having more urination, maybe you want to cut off at 8 o'clock, 8:30, to see if that helps out with your. Okay. Let's see. Appetite changes at all. Uh, you mentioned you're eating a lot more fried food. We talked about that already. Decreasing fried foods, decreasing greasy fried foods and fatty foods like that. Jaundice, any type of yellowing of the sclera at all. I don't see any of your eyes right now. The eyes, and let's see your palms of your hands. I don't see any yellowing of that. And open your eyeballs for me. Look at me. Thank you. No yellowing of the sclera of the eye. That's a good thing. Let's take a look here. Nausea and any nausea and vomiting at all. Any emesis, any spitting up at all. Difficulty eating? No. You mentioned about the heartburn. I'm going to look into that further about that. You said it was a burning in throat. And there's not a pain so much because there's a burning, right? Burning in throat. We'll look at that further. Any type of burping or belching and all that you have. Your main thing was gas, right? Gas here. Flatulence is gas. So we'll take a look at that. You said, but it's easy to expel gas. So changes to bowel habits. Let's see, in your stools, are they a yellow color or brown color?
Brown.
Okay, so no melena then. Any type of hemorrhoids, internal or external at all? Like grapes falling from the rectum of the behind? No. Okay, and no constipation, no hard stools. Diarrhea to looser stools. And you're able to eat all kind of foods, no food intolerance, and able to eat any kind of foods, you can eat anything. Okay. You mentioned here frequency of urination, but only at nighttime. You said regarding with excessive drinking water, so we're going to note that here. Excessive fluid, we're going to limit fluid intake here. And no urgency, you have to pee right then, urinate right then and there. You have to go. No here. And no burning sensation, dysuria here. Okay. And incontinence, and you're able to hold your urine okay. So for females here, no problem with holding your urine. No used to need to use Kegel exercises, holding your holding in or pulling in the muscles in the bottom of the urinary for like 10 seconds. 1, 2, 3, 4, 5. Help to tighten those muscles up to help to prevent incontinence or difficulties holding urine. Okay, none of that. Any type of trouble at all? You said you had big babies there. Currently, are you on any birth control at this time? Any contraceptives at all? No. Let's see. Any HIV at all exposure? Okay. Okay. March. Your menstrual cycle currently right now, does it flow 5 to 7 days? No. No menstrual cycle. The last time you had a menstrual cycle was when?
Years. I don't know.
Okay. Did you ever have a hysterectomy done, or did it stop on its own cessation? Stop. And when do you think you had your menopausal stop? Menopause stop. Do you think was it the 50s or early 60s, 50s, mid 50s? You think, or early 50s, or late 50s? You think you stopped your menstrual cycle, blood flow? But I'll put 50s in here for menstrual menopause, and it stopped on its own cessation here of menses. Okay, on. And no type of estrogen replacement at all, progesterone at all. Okay, and let's look at here. At the time when you did your menstrual cycle, did you have painful menstrual cycles, dysmenorrhea, pain when you had your menstrual cycle? Did you have?
I used to have, really bad ones.
Past,
I had blood clots.
Wow, past blood clots.
And I would flow for 7 days.
7 days, heavy menses passed. It was kind of good you stopped, huh? Thank goodness for that.
When I had my first child, it stopped.
Oh, wow.
It slacked up a lot.
Wow, well, that's a good thing. Let's take a look. Did you have any at the time? PMS, premenstrual syndrome, past premenstrual syndrome. And then, did you have bleeding in between your menstrual cycles too? Did you have bleeding or problems after your intercourse at all with intercourse? Menstrual period was in the 50s. Any type of vaginal discharge at all?
Mm-mm.
No. Here. Any itching, soreness, lumps?
Mm-mm.
None there. And any hot flashes?
Mm-hmm.
Had hot flash history in the past?
Mm-hmm.
When does your hot flashes stop, or do you still have hot flashes currently?
I think I still get them sometimes.
At times, so intermittently, PRN hot flashes. Okay. And no postmenopausal, no bleeding at all after that time? No, here. Thank you. So, dealing with peripheral vascular blood flow circulation, any type of problem with coldness at all, or tingling sensation in your legs, your arms, your feet, any type of numbness at all, any type of leg cramps or varicose veins, any type of history of blood clots, discoloration of the hands, and
Just varicose vein.
you have the green, and your veins kind of show up pretty much in your legs or your arms. They come out. Sometimes they're purple. Sometimes they're green. They kind of show up more so at the top of the skin layer. The
Mm-hmm.
skin, your veins shop
I
up
think I got some right here.
on the side of your left inner thigh.
Leg.
Left inner leg. Left, thank you. Left inner leg. Any pain at all?
Mm-hmm.
Inner leg. Oh, left inner leg. Varicose veins. Thank you for telling me. And no trouble with blood flow circulation at all with your legs at all, your feet. Okay.